Hi everyone, my name is Letitia Warnick. I am a PGY2 pharmacy resident in internal medicine at Buffalo General Medical Center. I'm very excited to be starting you off in Women's Health Lecture Series. This first pre-class video will provide background information regarding vaginal and vulvovaginal disorders. In my experience, patients in general have a lot of questions about these disease states, as well as questions regarding the many different products that are available, especially when we're talking about over-the-counter agents. So this is a really great area where pharmacists can have an impact on patient care. In review of the course objectives, by the end of this presentation, you should be able to differentiate between common vaginal infections, including vulvovaginal candidiasis, bacterial vaginosis, and trichomoniasis. You should also be able to distinguish between patients eligible for self-care or over-the-counter management from patients requiring a medical referral, and you should also be able to help identify primary treatment strategies for both types of patients. There are some required readings for this section. I have them listed here for you. I encourage you to take some time reviewing the readings and becoming familiar with the information prior to coming to class. A little bit of background information. Both vaginal and vulvovaginal disorders are common issues for women of both childbearing age and for older women. Of all the patients that experience vaginal symptoms, 65% of patients will have symptoms as a result of one of the three main vaginal infections listed there for you, which include vulvovaginal candidiasis, bacterial vaginosis, and trichomoniasis. In some women, these can occur somewhat frequently, and in general, most women see these as minor issues or disturbances, and may not see any urgency in seeking out a provider, or may think that they can manage these infections on their own, since we know that there's a lot of over-the-counter products available. However, some of these infections can be associated with other, more complicated disorders. Specifically, bacterial vaginosis and trichomoniasis are associated with disorders including pelvic inflammatory disease, preterm labor, urinary tract infections, and endometriosis. It's important that we educate patients about when self-care is appropriate and when they should seek medical attention. When talking about these infections, it's important to review the normal ecosystem of the vagina. The vagina has a normal pH of 4 to 4.5, which is slightly acidic. This is a result of bacteria breaking down glycogen in the vaginal canal. This process causes the release of lactic acid, and also bacteria will also directly produce hydrogen peroxide. So we have two different factors reducing the vaginal pH. And really, the low vaginal pH helps to prevent pathogen growth. The vaginal ecosystem is typically in homeostasis. However, there are a couple of factors that will affect the normal balance, including hormone fluctuations, age, medications, and other factors, as you can see listed there on the slide. Next, we'll spend the rest of the presentation going through each infection, and we'll discuss the available treatment options and when patients need to seek treatment from a medical provider. First, we'll start with vulvovaginal candidiasis. This is also known as your typical yeast infection. It occurs as a result of the pathogen Candida albicans. It's important to note that about 20% of patients are colonized with Candida albicans and are asymptomatic. Other common pathogens include additional species of Candida, Candida tropicalis and Candida glabrata, and also Saccharomyces species. For patients with vulvovaginal candidiasis, they may present with white, curd-like or cheesy-like discharge that does not have any odor associated. They may also present with symptoms such as itching, burning, swelling, pain, external dysuria, or redness. Objective findings include culture data for patients that are evaluated by a provider. Another key finding of vulvovaginal candidiasis is the pH, which remains within the normal range of 4 to 4.5. This is a key component of how you can get to distinguish vulvovaginal candidiasis from some of the other vaginal disorders. Over the counter, there are some vaginal pH testing devices available which can help assist patients in distinguishing if this is related to Candida or if this is one of the other vaginal infections. Vulvovaginal candidiasis is associated with some risk factors that may predispose patients to increased likelihood of infections. The most common include pregnancy, onset of sexual activity, diabetes, and high intake of refined sugars. There are also medications that increase a patient's risk of infection, most commonly antibiotics, specifically amoxicillin and cephalosporins, patients that are receiving immunosuppressants, and high-dose estrogen therapy. When thinking about the treatment of vulvovaginal candidiasis, it's important to be able to distinguish between patients who are eligible for self-care or over-the-counter management versus patients requiring further medical evaluation. This is a critical step for the pharmacist because our evaluation will help to guide these patients down the appropriate treatment pathway. You can see here some of the factors that we need to consider for patients with uncomplicated infection, which can include infrequent episodes, mild to moderate symptoms, and lack of systemic symptoms. There are specific features for patients with complicated infection you can see on the right-hand side. And for these patients that are having a complicated infection, they must refer to a provider, a medical doctor. These include patients with severe symptoms, patients with systemic symptoms like fever or pain, young girls less than 12 years of age, any patient with an immunocompromised disease such as HIV, and patients with recurrent progression, so if they've had the infection and it's not getting any better, and patients who may be pregnant. Again, it's very important that when you're looking at patients with vulvovaginal candidiasis, it's very important that you can distinguish whether it's an uncomplicated or complicated infection. Luckily, for patients that are able to be managed by self-care, or there are some over-the-counter agents available. The medication class available is considered topical imidazoles, which includes clotrimazole, miconazole, and teoconazole. These agents work by inhibiting the fungal cell membrane permeability by reducing the production of ergosterol, a key component of the fungal cell membrane. There are a lot of different products available, and selection is based on patient preference and possibly cost. On this next slide, I have listed some of the available products. You can see based on the product and formulation that the length of therapy may be different. So really, when you're talking to patients in the over-the-counter setting, so in your outpatient pharmacy, I always make sure to check the box for the directions to be sure of the length of therapy. You'll notice that some of them are listed as creams or vaginal suppositories. That's also another area. We want to make sure that patients are using these as prescribed. This chart also includes some of the prescription products available, and the most common medication prescribed is the fluconazole down at the bottom. It's usually given as a dose of 150 milligrams, given as a single dose. So this fluconazole is something that you might see patients who have a complicated infection. In reviewing some of the over-the-counter topical imidazoles, onset of action is usually 2 to 3 days for symptom improvement, which is an important counseling point for patients. So they may not see improvement right away. They will need to be patient as it may take 2 or 3 days. Since these agents are administered topically or vaginally, there is less systemic absorption, approximately 3 to 10% based on the product. This is important because it reduces the risk of systemic side effects and reduces the risk of drug interactions. Some of the adverse effects of these agents include vulvovaginal burning, itching, and irritation. And again, that's because you're applying that product right into the vagina. There are some alternative medicines that have been used to treat uncomplicated yeast infections. Again, it's important to remember that this is for patients who are able to take over-the-counter medications or are able to be treated via self-care. Gentian violet dye involves soaking a tampon in this dye and inserting it into the vagina overnight as a single dose. Boric acid can be used as a capsule or suppository administration. It's important to note that there's limited data available on the efficacy of these products. You also have other products that contain lactobacillus. These products are aimed at reestablishing the normal vaginal flora, although data, again, for these products remains limited.